Assalamu alaikum, everyone. Joining me today is Dr. Ahson Rabbani, who is the CEO of ChildLife Foundation. This is the third podcast where we will be raising funds for the support of flood relief victims in Pakistan. Today we'll be discussing about, the need to provide support to the most vulnerable flood affectees, and that is children and their mothers. So before we start the podcast, so I just want to let the viewers know that they can donate to ChildLife Foundation, which is actively working on the ground, providing relief to the children. And they can do that by going to this link. So this link is also provided in the description. And the viewers can also scan this QR code. So this QR code can be shown in the screen. Dr. Ahson, I would like to just highlight a few facts. So number one, so 33 million people are affected in Pakistan because of these floods, and nearly 50% of them are children. So that means 16.5 million children are affected because of these floods. And 40% of these children, according to UNICEF, suffer from stunted growth. And right now, 400 children have died because of the floods. And 18,000 schools have either been damaged or completely destroyed. And then, you really elaborate on the fact that, there are many risks that the children are facing at the moment. So one is, there's certainly going to be an outbreak of diarrhea, cholera, malaria, and these are some diseases. These are some of the diseases that can prove deadly to children. So, Dr. Ahson, my first question would be, first of all, thank you so much for joining this podcast. So my first question would be, what are the major risks, posed to the children as a result of these floods in the short run and as well as in the long run?
Walaikum Assalam. Thank you, Hamza, and appreciate feeling blessed holding these podcasts and fundraisings for flood victims. I know the picture is very grim, but let's not lose hope. I mean, there's a very famous couplet in Urdu, which goes something like this. खुदा से मत कहो कि मुश्किल कितनी बड़ी है, तूफान से कह दो कि मेरा खुदा कितना बड़ा है. So yes, we have challenges and things look grim, but the humanist spirit is much bigger than these. Pakistanis have fought bigger challenges in the past, and inshallah we will fight this one as well. ChildLife itself is a proof, which it was founded as a reaction to the 2010 super flood. And this is our chance to be reborn and revitalize and serve the people. You are right, about 1,000 plus people have drowned, 400 of them are children. But the biggest demon is yet to come. It is waterborne disease. If out of these 30 million people who have been displaced, at least 3 million are those children which are below the age of 5 years. Now, international aid agencies and health organizations believe that of these 3 million children, 40% would have a serious health risk due to waterborne diseases. And we need to save those, because the diarrhea epidemic, the cholera epidemic is going to claim thousands of lives unless we act fast. So ChildLife, as the name says, is focused on children. They are the most vulnerable. In any disaster, you go through the process of rescue, relief, reconstruction. I believe the rescue process has been done well. The loss of lives has not been very high, although 1,000 plus is a large number. But if you compare the earthquake of 2005, 80,000 people died due to the earthquake. And then you had to take care of the injured. So in this case, we want to make sure that we are able to prevent the deaths now, especially of children. That's why all the health community, I mean, Medicine is a noble profession. It's really a calling, not a profession. All organizations have to come forward and do their part in saving lives of the people who have lost everything. And ChildLife Foundation, I'll share with what we do, but our focus is on hospital care.
Okay, Dr. Ahson, thank you so much for that overview. So, this brings me to my second question. So what is ChildLife Foundation exactly doing on the ground to provide relief to the children in terms of, providing emergency care, preventive care, and primary care?
So since 2010, when we were founded as a result to the flood, today we have a presence of saving children in 93 government hospitals across Pakistan. This includes every district of Balochistan. This includes every district of Sindh and half the tehsils already. Plus, we are also in Lahore and Islamabad is receiving now flood ravaged victims from KPK, and Lahore is receiving from South Punjab. So because of this network, we have feet on the ground to provide care and to make an impact of saving lives. So the volume of patients in the flood affected areas have tripled. In places where we were dealing with 300 to 400 patients daily, the number has crossed 1,200. So it's really very high volume. And in addition to this, we are going outside and conducting health camps in Balochistan and in Sindh, where we are treating not only children, but mothers also. This is a time of this is the time when medicine becomes the noblest profession. कहते हैं ना, नबियों वाला काम है मेडिकल वाला, ये जान बचाने वाला काम, इसी दिन के लिए हम ओथ लेते हैं, मेडिसिन में आते हैं. And telemedicine has been a big saver. The places where roads have been washed away, where you cannot get people in, but if you have telemedicine connection, we have people on the ground, the work goes on, the treatment goes on, because cholera and diarrhea, we hear about it, but now we are at the onset of dengue and malaria, and we have huge issues with skin diseases because children have been exposed to dirty water.
And so you mentioned about the services being provided to children. So what about services being provided to the newborns specifically? Because, you need, a special set of doctors to provide healthcare to the newborns.
Newborns are very sensitive. Half of the child mortality in Pakistan relates to children which are less than 1 month old, which is the newborn, or neonates as we call them, and they require special care. So in our emergency rooms, we have a separate area for taking care of newborns or neonates, so that they do not get missed out when we are taking care of older children, pediatric care. The birth doesn't stop. It happens 24/7. Floods ka matlab ye nahi hai ke bacche paida nahi ho rahe. So we need to take care of them. And with about hundreds of health facilities damaged or washed away, the load is now coming more to the tertiary care or the larger hospitals.
So, Dr. Ahson, what is the long-term plan of ChildLife Foundation in terms of, providing rehabilitative care to children and especially to mothers?
This flood of 2022 is teaching us many things, but the biggest factor is you need to develop your health systems. These calamities is not a matter of if, but when. We will have to face another one. So we have to start getting ready for the next one now. And you cannot just send out teams. You need to have infrastructure in place. You need to have a good health system. So what we have learned, that today we are in 93 hospitals. We have plans and we have pledged that we'll expand this network to every tehsil of Pakistan, every teaching hospital of Pakistan, inshallah, within the next 5 years. So whenever, God forbid, the next calamity comes, we are able to save our fellow countrymen, whatever be it an earthquake, be it a disease epidemic, or be it floods. You need to strengthen the health systems. You need to institutionalize it. That's how you manage disasters. They say good intentions don't move mountains. Bulldozers move mountains. So you need to have your bulldozers ready. And long-term starts today. If you want a strong health system in southern Punjab, Rajanpur mein jo ho raha hai, you need to improve the health system today so the next calamity, 3 years, 5 years down the road, we are able to deal with it.
And not to mention the infrastructure, the roads, the hospitals, the different clinics, because right now, a lot of populations, as we were discussing before the meeting, a lot of populations have been isolated because of these floods. And that has just made providing healthcare even more difficult.
That's my point. Feet on the ground. There will be crises when you can't access them. The advantage we are having right now is that our teams live there. So they walk from their homes, if they need to the hospital. And local community will have much more ownership than anybody coming from outside. तो सखर के जो डॉक्टर्स हैं, सखर के जो नर्सेज हैं, उनके घरों के अंदर पानी है. They have got water inside their houses. They have got their own children inside water, but they are turning up for duty. We have a nurse in Jhalmaksi. His house has been washed away. He is turning up at district headquarter hospital at Jhalmaksi to provide service. This is commitment which comes from the community member. That's my point. We have to have strong health institutions in every corner of Pakistan. That is, you can only do when you strengthen the health system, and no one organization can do it. You have to work with the government within that system, because that's the only large setup.
And Dr. Ahson, what specific requirements do you have that you want to share with the viewers? So in terms of funding, so how much funds do you require?
Any organization which is doing good work on the ground, I would say increase their funding so they can deliver more. That's a critical element. For us, for ChildLife, it takes $7 to treat a child in the emergency room. With the volume goes 3 times, which means our budgets will be busted. So I appeal through this podcast to Pakistanis to lend that helping hand to all organizations that they trust and help in any way they can.
And let me reiterate that viewers can donate to ChildLife Foundation by going to this link. So this link is also mentioned in the description, or you can, scan this QR code and make the donation. And, I would request the viewers to to contribute as much as possible. And if not, at least share this podcast with your friends and family so that they can donate to ChildLife Foundation.
Very important to note that 100% of the funds given in the US are reach Pakistan. The overheads of ChildLife in US is zero. So when you donate $100 in US, $100 are received in Pakistan. In Pakistan, the overhead, the management cost of ChildLife is 9.2%, single digit. That is taken care by the trustees' donation. So you can rest assured that 100% of your donations will reach the services in Pakistan. And it is tax exempt in the US and Pakistan, and it is also zakat applicable.
Dr. Ahson, thank you so much for your insight and for giving us a very detailed overview of the services being provided by ChildLife Foundation and what's the situation on the ground. So with that note, I'd like to call off this podcast and, and let viewers donate as much as they can. So Dr. Ahson, thank you so much for joining today.
Thank you. Jazakallah.
Thank you.